Hello, how are you? Today, I am going to tell you what to do to lower your blood sugar when it is high and what you need to do to prevent it from rising again. Stay until the end. You will not want to miss it. Let's start talking a bit about how to lower blood sugar. It is very important that the levels of sugar in our blood, our glucose, remain stable and within an ideal range because elevated blood sugar is toxic to our bodies. Sugar is very viscous. It actually makes your blood thicker. Over time, this increased viscosity can affect how easily your blood flows through your vessels. So, in the medium and long term, if your blood sugar remains consistently elevated for years, it can begin to contribute to some of the complications commonly associated with diabetes. So, it is really important for us to keep those levels within the ideal range. What are these problems we are talking about? Studies have already shown all of these problems in the medium and long term. If you keep your blood sugar elevated many times a day, many days a week, routinely, this can cause vision problems, circulation problems, and issues with your kidneys. So, we want to keep our bodies always functioning well. The big problem is that many people already have some form of pre-diabetes, or are type 2 diabetics, and do not know it yet, which is why it is so important to pay attention to the symptoms and signs that our bodies show us. Now let's talk about how we can prevent blood sugar from getting too high. It is very important to remember that usually, the time when your blood glucose, the sugar in your blood, will be at its highest during the day is what we call the postprandial period, that is after you eat, but not immediately after. Normally, it is about 2 hours after your meal. That is because when we eat, the food in our mouth has to go down the esophagus, pass through the stomach, reach the intestine, and only then enter the bloodstream, causing the glucose to rise. So usually, we say that during those 2 hours after eating is when your blood glucose or blood sugar will be at its highest. And we know that what we eat is directly related to how much our blood glucose or blood sugar will rise, as well as how quickly it will be absorbed. This process can be slower, helping to avoid those high spikes that are dangerous for your health. Or it can happen in a slower, more gradual, and more balanced way to help you keep your glucose and blood sugar levels more stable. So, let us talk about what you can do to prevent your blood sugar from rising in a very practical way for your daily life. Here are some tips you can start applying today to begin seeing results. And then, I will tell you what you can do if your blood sugar is already high to help lower it. My first tip for you is to be very careful with both the amount and the quality of carbohydrates you consume. We already know that carbohydrates are the food group that actually has the greatest impact on raising your blood sugar. So, depending on the type of carbohydrate you eat, but also on the amount you consume, this will have a greater or lesser impact on your blood sugar after your meal. There are several very interesting explanations about glycemic index, which is precisely the rate at which carbohydrates are absorbed. There are also some great tips on which carbohydrates you can eat. If you are not familiar with glycemic index yet, it is worth understanding because it directly affects how fast your blood sugar rises after eating. Let me remind you that the carbohydrates with a lower glycemic index are the ones we should preferably consume, especially if we are diabetic, pre-diabetic, or want to keep our blood sugar levels stable. Which ones are these? They are the carbohydrates that have a lot of fiber, a lot of protein, healthy fats, or a combination of these. So, it is a good idea to eat foods like sweet potatoes, quinoa, beans in general, lentils, chickpeas, and oats. These are all nutrient-rich options. But just because these carbohydrates are healthy, it does not mean we can eat them in large amounts. Many people say that oats have sugar. In reality, oats do not contain sugar. They contain carbohydrates, fiber, and also a bit of protein, which is why their glycemic index is lower. The big problem is that people think oats are healthy and end up eating 5 tablespoons and making a large bowl of porridge. In that case, glucose will rise a lot. If instead you use just 1 tablespoon, add coconut milk, and include a bit of chia, you can modulate the absorption of this carbohydrate so that it is absorbed more slowly. You can also choose to follow a diet that is restricted in carbohydrates, such as a low-carb diet or a ketogenic diet. For many people who are diabetic or pre-diabetic, this approach brings excellent results. Another very important tip is to control the amount of food you eat. You do not need to buy a scale and weigh everything. That is not the idea. What matters is having some awareness of how much you are eating. Keep a mental count, like saying to yourself, I am putting 2 spoonsful of this brown rice on my plate and adding about 4 spoonsful of beans. This gives you a rough idea of your portions. It is very easy to lose track of how much you are actually eating, especially when you are busy or distracted. A diabetic who is out of balance often feels very hungry because blood sugar levels are high, but sugar is not able to enter the cells properly. The body thinks it needs more fuel. Even though there is a lot of glucose in the blood, the cells are not getting what they need, which is sugar. So, the body keeps sending hunger signals. This is why an unbalanced diabetic feels hungrier. This is normal. The person is not imagining it. This is a physiological response. Hunger increases, mood can drop, and irritation can appear because that is how the body reacts when it feels deprived of energy. So, in this case, it is much easier to lose control and end up overeating. It is very important that you already know how much you should consume so that your blood sugar does not get too high. You can start by testing this, and a local nutritionist can help you with this by better calculating your diet and organizing it for you. But you can already start even before an appointment by keeping a diary and taking notes. On this day, I ate 3 tablespoons of this, 2 of that, and my blood sugar was like this. Then you measure it after your meal to see how your diet is affecting you. This is a really great tip. Another good tip is to be very careful with food labels because when we consume processed products, sometimes the term diet appears and it gives the impression that you can eat more of it, but the amount of carbohydrates can still be high. This is the case with diet chocolates. They do not have sugar, but the amount of carbohydrates is practically the same as regular chocolate. So, it is really important that you know how to read a food label. I know that this issue of portion control can sometimes be a bit complicated. Binge eating can also happen to people, and sugar cravings are very real. When someone tells you that you cannot eat something, it often makes you want it even more. This reaction is common and very human. It is like when you have to do a blood test and are told to fast for 12 hours. You often end up feeling even hungrier. Besides that, as a lifestyle habit, it is important to remember that staying well hydrated helps keep blood glucose lower. When we urinate more, excess glucose can leave the body through the urine, filtered by the kidneys. This is not ideal, but it helps as a compensation mechanism. So, staying well hydrated matters. It is also important to add some kind of physical activity. Physical activity improves the sensitivity of the cells. During exercise, muscle cells are able to absorb glucose more easily, which helps stabilize blood glucose and sugar levels. Good sleep also matters. Poor sleep increases stress, and stress raises glucose. Try to maintain a calmer lifestyle and support habits that help you move more, drink more water, and rest better throughout the day. Tips for you to try to incorporate this into your daily routine include lifestyle habits and sleep-related strategies that can also help. It is important to maintain a wide variety in your diet because some micronutrients can help improve insulin resistance, reduce that resistance, enhance insulin secretion, and keep glucose levels more stable. The 2 micronutrients with the strongest evidence are chromium and magnesium. Chromium has been studied for its role in improving insulin action. Magnesium also plays an important role in glucose metabolism and insulin sensitivity. Let's quickly go over the main dietary sources so you can apply this in daily life. Magnesium can be found in beans, dark chocolate, some nuts, and dark leafy greens. These foods can support more stable blood sugar when included regularly. Now, if your blood sugar is already elevated and you want to lower it, it is important to talk about medication. People with diabetes usually take some form of medication. This can be oral medication or insulin, which is a subcutaneous injection of the hormone. This is often needed because the body is not producing enough insulin, or is producing it but cannot use it effectively. With oral medication, consistency matters. You need to take it at the same time every day. It is not a good idea to increase the dose just because your blood sugar is high. If your blood sugar stays high even when your diet is correct, you need to talk to your doctor. They may need to recalculate and adjust the dose. Never increase or stop medication on your own. Insulin requires a different type of management. For people with type 1 diabetes especially, carbohydrate counting helps determine how much fast-acting insulin to take. Doctors usually prescribe a fixed dose of long-acting or ultra-long-acting insulin and allow adjustment of ultra-fast-acting insulin based on carbohydrate intake. If you use ultra-fast-acting insulin and have a plan agreed on with your doctor or nutritionist, you may adjust the dose within that plan. If you are given a fixed insulin regimen and still cannot control your blood glucose despite following the correct diet, your doctor may need to adjust it. Regular medical follow-up matters. Medication doses need to match your weight, diet, and current health status. Infections and other conditions can also raise blood glucose. Always follow the regimen that was prescribed and never change it on your own unless it has been discussed and approved. Hydration also helps lower glucose. Drinking water increases urination, which allows some glucose to be eliminated through urine. This is not a cure. If your glucose is very high, drinking water alone will not fix it, but staying hydrated can help keep levels from rising further. Physical exercise can also help, as long as your blood sugar is not above 250 milligrams per deciliter. If glucose is higher than that, especially in type 1 diabetes, exercise can increase the risk of diabetic ketoacidosis, which is dangerous. Always check your levels and use exercise safely. If your blood sugar is slightly elevated, you can go for a walk. But if it is very high, it is best not to exercise. Always remember to talk to your doctor about this, because it may seem counterintuitive, but exercising with very high glucose can acidify your blood pH, and that can be dangerous. Another important point is that exercise should be lighter and mainly aerobic. If your blood sugar is already elevated and you do weight training, the stress can actually cause your blood sugar to rise even more at first. It is also important to consult a physical education professional to guide you properly. To make this very clear, regular physical exercise helps control blood sugar. Low-intensity aerobic exercise, when blood glucose is only slightly elevated, can help lower it. The problem is when blood glucose is very high, above 250 or above 300. In that situation, the recommendation is not to exercise. You should also avoid strength training, such as weightlifting, when your glucose is already elevated because it can initially increase blood sugar. If it is already high, that is not what you want. Physical exercise is very beneficial for keeping blood glucose lower, but only with proper supervision. Now, regarding teas, many people say they drink cinnamon tea, hibiscus tea, chamomile tea, or green tea and notice that their blood sugar goes down. These teas can help keep blood sugar lower as a complementary habit throughout the day. They work best alongside physical activity, properly managed medication, and a well-structured diet. There are no scientific studies showing that drinking a cup of cinnamon tea will lower blood sugar from 250 to 200. There is no clear scientific consensus on how much to take or how long it takes to reduce blood sugar. These teas help in a synergistic way, but they are not medication. It is important to use good judgment and not rely on teas alone to control blood sugar. For some people, they help a lot. For others, they have little effect. Results vary. There are studies showing a relationship between consuming these teas before or during meals and reduced postprandial glucose. This happens because they can support insulin secretion and improve the sensitivity of target cells. However, there are very few studies examining their use when blood sugar is already high. That distinction matters. If you are looking for a more natural approach to help keep blood sugar controlled as part of a broader routine, certain teas and plants can be useful additions. Many are easy to find and are often already available at home. If you deal with high blood sugar, reflect on what helps you lower it and what works best for your body. Sharing experiences can help others learn what may or may not work for them.